right. Well, this time, the question was asked, when should I do veneers? When should I do orthodontics or braces? Or should I do both? And that is actually a very good question and a very common question that we field here in my practice. There really is no right answer, and you have to choose whatever you are most comfortable with. Having said that, I usually like to tell people that orthodontics can take a person that has crooked, ugly yellow teeth and give them straight, ugly yellow teeth. Whereas porcelain veneers can do change the color, change the shape, change the size. It has a lot more control. Also, you should also consider how much correction am I trying to do orthodontically. If I'm only trying to correct something maybe a millimeter, it may not last very long, because when we orthodontically move teeth, there's going to be some settling in. The teeth are going to want to move a little bit after the braces are taken off, and that settling may be the exact millimeter that you just gained by doing the braces. So you can minimize the effects or the settling by wearing a retainer. If you're only trying to correct a half of a millimeter here and a quarter of a millimeter there, then really veneers probably is a better option. Certainly more quick. Typically, we tell people that the start to finish of a porcelain veneer case, truthfully, if planned in advance, can be done in a matter of days, 3-4 days, and you're done. But most of the time, we tell people plan in a couple weeks. We'll prep the teeth on the first of the month, and we'll be bonding them in place by the 15th. So we try to schedule it in such a way so we can be done within about a week. And if all the stars align, we can get it done in 4 days if the lab is pre-scheduled and we can coordinate things better. Now, there's also the combination. Now, many times teeth would benefit from the improved shape and color and size and everything, but if I do veneers or crowns immediately, what ends up happening is we have to be very aggressive, and we may end up having to do what we call elective root canals, meaning there was no disease or pathology, but if I just prep the teeth for the veneers into the ideal position, the nerves will be exposed and would need to have root canals. So we devitalize initially and then finish the case. To me, that's a bit aggressive. That's not that we don't do it, but if it was my own mouth, I would prefer to spend a little bit of time in orthodontics, line the teeth up, give me a better alignment before I do the veneers. It takes a little bit longer, but a little bit more conservative. It certainly does add to the expense. None of this is without associated costs, but the combination of porcelain veneers and pre-prosthetic orthodontics oftentimes gives us the best result.
Dr. Timmerman is known internationally with licenses in multiple states in the United States, plus Belgium and Dubai, for cosmetic, implant, and sleep dentistry, with fellowships in the International Congress for Oral Implantology and the Academy of General Dentistry, and a diplomate in the American Board of Dental Sleep Medicine. If you would like to become a patient of Dr. Timmerman or simply have questions, please go to our website, www.drtimmerman.com. That is www.drtimmerman.com. Or call us at 206-241-5533. Or you could email questions for an episode of a future podcast at thewholetoothpodcast@gmail.com.